Hey, everybody, guess what? We are live this afternoon. I have Elizabeth Moss here, and she is the founder of Wholecare. How are you doing this afternoon?
I'm doing great. It's a beautiful, sunny, warming up day. Glad to be here. Thank you.
Yeah. Tell us a little bit about, you told me you founded Wholecare. Tell me about that and what that looks like.
Well, I founded it in 1997. So I am a nurse by trade and background, and I had done private duty through nursing school. And so my heart just kept tugging at me saying, really your passion is one-on-one care. So I started doing private duty nursing, and 3 families asked me to help them. And so that's how it started. And that was 23 years ago. And we have depending on the week, we have 75 to 120 caregivers. And we are in the homes of our clients, wherever that they call home. Some people are still at their home they raise their children in. Some people are at a downsizing or right sizing home. Some people are in assisted living and or even in a long-term care facility. But wherever that is, we provide that extended support to help them be as independent and high functioning as possible. And so the services are that we provide transportation through end of life. We can help people get to their dialysis appointments, to their beauty shop appointments when those open back up, to the Frisk Center for Social Activities, or whatever that looks like for them individually. And then we provide 3 levels of care. So those are skill levels based on the needs of the client and the skill set of the caregiver. And light housekeeping, meal preparation, all the way up to full care, meaning bedbound clients needing hospice care. We work hand in glove with hospice and palliative care and home health and all of those short-term episodic service providers.
Yeah, you mentioned something to me earlier that I think is fascinating. You've not had anyone be sick that you care for, which is amazing.
Yes, it is amazing. We've gone to great lengths. I think that because I'm a nurse, and so it kicked in, my crisis management mode just kicked in immediately to start taking care of everybody and making sure that we were all protected. They were all protected. Because I've talked to other agencies across the country, and they still haven't gotten all the PPE for their clients and their caregivers. And unfortunately, nobody reached out to us to ask us what we needed, if we needed anything. I just had to get busy like everybody else that was trying to find the supply chain and order it. I even believe I got scammed because I found this great website and I ordered about $1,000 worth of supplies, and I've yet to get it, and they haven't responded to my emails.
Oh, no.
Mm-hmm. But the local business people have been the most resourceful for me to source, because like Corsair Distillery that's in Nashville pivoted and realized that their byproduct from distilling gin was not only compliant, but exceeded CDC regulations for hand sanitizer.
Mm-hmm.
And so I bought 8 gallons of that. And now we've added lavender oil to essential oils, and we've added coconut oil because otherwise everybody would be walking around smelling like tequila.
Well,
so we did our own little science experiment to help people smell better with lavender oil, and the coconut oil helps their skin not dry out as much with that much alcohol in it. And then another company, Logo Brand here in Nashville, they pivoted and they started sourcing masks and gowns and eye shields and I don't know what all. And so we've got lots of masks, and we've gotten gowns and eye shields from them in case we have a client that contracts COVID, then we're prepared. And we also implemented a policy of temperature logging. So our caregivers are required to take their temperature and record that on a form that we gave them in their home before they leave for their shift. And then when they get to their client, they are to take the client's temperature and record that at the beginning of their shift. So at least we're tracking some of those maybe could be early symptoms of things. We've also realized that elderly people are presenting different symptoms than the commonly general symptoms of COVID-19. But, I'm going to knock on wood that our clients have enough issues going on. They're chronic, and so they are very at risk, but none of them have gotten any illness other than what they already had prior to this situation.
Yeah, that's pretty amazing, because we've all heard the cases where people who are in assisted living areas or nursing homes who have contracted that, and it seems to spread pretty quickly through those types of places. So another reason, if you could try to care at home.
Yeah, so people are safer at home.
Yeah.
Clients and us included.
Yes. Tell me about how many people you have working for you and that cares for the community.
We have internally, our office team is a team of 7. And then depending on, our client load, we have 75 to 120 caregivers that are working any given week.
Wow, that's a pretty good number. So again, that really says a lot to what you guys are doing, that all those people have been able to stay well throughout this entire time. Yeah. You did tell me there are a few clients that have chosen not to extend care because they were on the lower end. Tell me about that.
Right. So people who need just a little bit of help, maybe they need that light housekeeping and a trip to the grocery store. They're not driving, or the trip to the beauty shop. Otherwise, they're pretty independent still. They've stopped services because they didn't want to risk getting sick. And that's okay. Good for them. They can. But there's many other clients that, can't do that. They require the help to be able to function on a daily basis. We've also had caregivers that have called in and said, I'm caring for my mother. She lives with me, and I can't continue to work because I don't want to risk bringing something home to her. And we respect that. And we say, okay, call us when this is all over and we'll put you back to work.
Yeah. Yeah. So tell me what it looks like. Have you had an increase maybe in other requests for other people who need help right now?
That's beginning to come along last week and this week. I think everybody just went on pause for 5 weeks. And as I believe that this is going to be a new world. Nothing's going to be like it was before. With that said, I believe we will normalize in this new world, and it will look different. We'll have to act different. We'll have to behave different. We'll have to do things differently. Like we've already done everything differently, from the last 5 weeks. Like I said earlier, I've been in crisis management mode, and as a nurse, it just kicked in. And so I started, even before we had to work remotely, 2 weeks before that, I asked my IT guy, were we prepared? If this happens, are we ready to work from home? We had one little small thing to do, and that was it. And so we were prepared. So then next it was the PPE. And then, so I put together Zoom meetings also to bring community for the caregivers because they're isolated as it is. And so we had 5 Zoom meetings a week for the caregivers. I had 3 Zoom meetings a week for the office staff plus one-on-ones, and got all of that in place. I've created a Wellness Wednesday Zoom meeting for the caregivers and the office team where, there's a lot of anxiety, and uncertainty creates, depression a lot of times in people, and creates worry and fear and all of that. So I wanted to bring local people who could help bring a sense of calm to my teams, the office team and the caregiver team. And so I did that with a mindfulness coach, and she helped us with deep breathing and little guided meditations. I brought in a friend, Allison Stillman, who's an alchemist, and she's been learning and growing and distilling plants to make essential oils and blends. And so she came on and educated us about, how to use essential oils and the benefits of those. I have another friend who is a life coach and a pastor and a professor. And so he came on and talked about the difference between healing and fixing. And fixing being a lot of technical sort of aspects of our life, and healing being adaptive aspects of our life, and how when we get anxious about something, it's really about the technicality of a system versus noticing that anxiety in ourselves and going, okay, what do I need to adapt in this particular system? So it's been really good. It's been helpful for me to feel like I can do something about the situation, when in reality we're so powerless over all of this, and there's not much we can do. So it gave me something to do and to be helpful and serve not only, my office team and the caregivers, but in turn serve the clients and the community. I got busy creating letters that assured all of our referral sources and our families and our caregivers and our clients what we were doing each week, that, the things we were putting in place and the things we were working on. We've launched new technology through this process, 2 different things. We have an app called Wholecare Connect, and we've partnered with Electronic Caregiver. And so we're promoting those. Now that Medicare is reimbursing for telehealth, we believe that's a huge part of care as well in the home. And so we're actively promoting that. It's not something that's brand new. We were already doing it. But for those people who needed to cancel to be independent, this would support them in some way if they needed help.
So does the app create or help negotiate telehealth for your patients, or how does it work?
The app is separate. Electronic Caregiver is a personal emergency response system, and it has the telehealth components to it. And so it can, through Bluetooth, communicate to the physicians the data exchange for diabetic patients, for cardiac patients, for, COPD patients. Sometimes they need to weigh often. And so there's scales and thermometers and blood sugar monitor and blood pressure cuff and all of those components to the Electronic Caregiver. The app is it's like a little Facebook page, but it's so if I'm in need and you're part of my circle of friends, and I create a wheel, a team, and I invite you. So when I have a need in real time, I type that in and it goes out to all of my team. So they know in real time what I need. And the first person who's available to fill that need types it in and said, I can do that today at 5:00. And everybody on my team knows that. So it's happening in real time. This app was created here in Nashville as in response to a guy who had a terminal brain tumor. And he saw the opportunity to create something that families would need to have that support in place in real time. But he could direct when it happened and how it happened just by, adding a little text. You can take photos through it, and there's, some other things about it. But if anybody's interested, you can go on the App Store, Apple and Android, and look for Wholecare Connect and use the code, the number 4 SAL, all caps. And
Okay.
that'll sign you up under Wholecare.
That sounds like useful for not just your patients, but you're saying other people can use the app as well.
You can. Like, I live alone, so I have a team. and I have 3 dogs, so they couldn't do much if something happened to me.
Right.
Or if I had my phone with me, I could request help. If I didn't have my phone with me, then I would have the electronic caregiver, which I haven't even thought about, but I need to put that in place because it's like it looks like an Apple Watch or something, and you just push that button for help, and it alerts the EMTs.
That's fascinating. That's very helpful. Well, tell us how the community can help Wholecare right now during this pandemic.
Well, one thing we requested is for everybody to reach out to your representatives and let them know that home care, I mean, we've kept people well and out of the hospital, that we need to be seen as a piece of the healthcare puzzle. Especially when it comes to PPE right now, that it needs to be readily available to us as well. I've got it in place now, but if in fact, what they're saying is that this could spike again in the fall, who knows, what our needs will be. And we're small. One of the challenges in getting the PPE has been getting the small quantities that we've needed. We're not a hospital. We don't need 500,000 masks. So getting 100 masks or 300 masks has been a challenge. So that's one thing the community can do. The other thing is remember us. When your loved one or your neighbor or your church member or somebody needs help, give us a call. We're happy to talk with you and see how we can help support you.
Okay, give us the website so people can find more information.
The website is www.caregivers.com. WHOLECARE.com. Our phone number is 615-298-9201.
All right. Well, it's been great to talk to you. I feel like I've learned a lot just in our few minutes together, and we'll make sure we put that website up for everybody.
Thank you, Donna. It's been great talking to you. Thank you for inviting me and having me on, and let me know if you have any questions.
All right. Thanks.
Okay. Thank you.
Bye, everybody.